Well, federal health officials are predicting Canada could face 10,000 new cases of COVID-19 a day by early December. The Prime Minister has implored the provinces and municipalities to do more to stop the spread. But is that response enough from the Prime Minister and the federal government? Amir Attaran is a professor in both the faculties of law and the School of Epidemiology and Public Health at the University of Ottawa. We have reached him today in California. Mr. Attaran, first of all, thanks for being with me. I appreciate it. Let me first get your reaction to the latest vaccine news that Moderna's vaccine candidate looks so far to be around 94.5% effective. How reassured should Canadians be by that news?
Well, this is great news. I mean, Pfizer was the big news of last week, and they were the leading vaccine last week. It kept that lead for 1 week. And we're already seeing another vaccine come out that equals, or in fact, I think betters that option. And we're going to see another half dozen or so before the spring, I believe. What our problem is now is in Canada to ensure we're getting deliveries of those vaccines early rather than late. And all indications are we'll get it, unfortunately, later than most countries. And also to be ready in the provinces to administer the vaccine. These two challenges have been very poorly addressed by Ottawa and, of course, by the provinces too. And unless we deal with that, we are going to be late on the vaccination game.
How have the responses lagged? Why do you say we'll be late compared to other countries?
For instance, we placed orders for some of these vaccines months later than other countries did. And it's not even clear from the Trudeau government whether we've actually placed paid up firm orders or whether we've just signed agreements giving us an option to purchase. And I and others have repeatedly asked the federal government to clarify whether our orders are firm, paid up, or merely options. And every single time the government refuses to answer that question, which of course suggests it's not firm and not paid up. But even if they were, the fact that we waited in some instances several months than other countries did to get in there with the suppliers means we are not going to be at the front of the queue.
All right. Look, clearly Canada's having trouble getting control of the second wave of the pandemic. What do you believe is needed now as a more effective response?
I think it is unacceptable that we have a difference of 10,000% in the infection rate between, for instance, New Brunswick and Manitoba. That's just shocking. You can't have one part of the country being 100 times worse than another. And yet this is what we see. It clearly calls out now for federal minimum standards. It is beyond time that the Trudeau government use its emergency powers in law to set a minimum standard that all provinces must live by.
If the government did invoke its emergency powers, what would look different? How would the response we're seeing now be different?
The federal government has the power to set minimum standards in an emergency. So it could set a standard that says, for instance, once you have a certain threshold of cases spreading in the community, there must be shutdowns of the riskiest transmission hotspots in the community. Without a minimum standard as to when things can open or must close, some provinces are simply tempted to wait too long, and then we get a massive explosion. The problem is that when they have that explosion, it imposes costs on the entire Canadian economy. So one province not behaving prudently lands the other provinces with a giant bailout bill. And it lands the other provinces with a failing economy. We can't have this. What we need to have is a minimum that Ottawa puts out there that all provinces must respect for disease control.
Right.
Because otherwise, we end up with the situation we have now, where the richest province per capita, Alberta, has a staggeringly high amount of disease, and the poorest province, New Brunswick, has very little. But who's paying to to subsidize the Canadian economy because of Alberta's failure. It's the poorer people in New Brunswick.
What about
This is destroying national unity.
What about local and provincial health officers? We talk about powers for the federal government. Those local officers and provincial officers, they have enormous powers to impose whatever measures they think are needed, but in most cases they haven't done that. Why not?
Yes, Peter, you're exactly right. And we wrote about this in Maclean's a few days ago with a colleague of mine, Professor Lorian Hardcastle in Calgary. They're not doing it, these local and medical officers of health, because they're afraid. They're pulling punches. They're letting their government, the provincial government, get away with murder in terms of not controlling the disease. And most of the local medical officers of health are simply wringing their hands about it. This absence of courage is killing Canadians. I can't be more clear about it. If you look at the United States, Dr. Tony Fauci has been utterly brave in standing up to Donald Trump, doing nothing about the disease. Where's our Dr. Tony Fauci in this country? Most of our medical officers of health are simply refusing to contradict their governments. And when they contradict, my God, they have all the power in the world to. They can issue mandatory shutdown orders, whether a premier agrees with it or not. But they're not exercising those powers.
All right. We'll continue to watch as this situation unfolds. Amir Attaran, always good to get your perspective. Thank you again tonight.
Peter, thanks so much. Stay safe.